All right, good morning, everyone. A very warm welcome in today's webinar hosted by Homeopathy 360. I am Dr. Noori, Senior Editor at BHMS. We are honored to have you all with us as we explore an often overlooked yet incredibly important topic in healthcare, which is stress, sleep, and immunity, the hidden triangle of health. In our fast paced modern lives, stress has become almost unavoidable, yet its impact, particularly on the sleep and immune system, is profound, interconnected, and often misunderstood. It is a privilege to introduce our esteemed speaker for today, Dr. Mrugank N. Meghani. Sir is a respected name in homeopathic medicine, blending academic rigor with compassionate clinical care. Sir was recently awarded a PhD in homeopathy in 2025 from Saurashtra University. Professionally, he has been an independent homeopathic practitioner for over 15 years and also runs a charitable clinic. He has served as an associate professor at Rajkot Homeopathic Medical College for more than 9 years and has been honored as Best Teacher as well as Best Mentor Award for Excellence in Homeopathic Education. In today's session, we will dwell into the scientific connections among these three vital areas and explore how homeopathy, with its holistic approach, can help restore balance. We'll also look at daily life examples, practical lifestyle tips, and a holistic framework for improving overall health. Without further delay, let's welcome our speaker of the day, Dr. Mrugank. Sir, we are honored to have you with us at Homeopathy 360.
Thank you very much, madam. A very good morning to ma'am and all our listeners for today's webinar. I am also very much thankful to Homeopathy 360 and Jain to providing us platform. So, rather than sharing my knowledge, I would say to put my point for a discussion, for awareness to all our listeners. I would also like to thank my principal, Dr. Mehta sir, my university, my college, the management. They are also providing us the platform for sharing our knowledge and to outreach the homeopathy to all other fellow faculty members and my students. Let us begin with my presentation.
So while Sir is sharing his presentation, I would also request the audience, if you have any questions, place them in the Q&A box and we'll try to take them in the end of the session. Sir, the stage is all yours.
Thank you, ma'am. As the slide is loading, I would like
I think there is some connectivity issue. We will wait for the Sir to join. Thank you for your patience. Sir is joining in just a minute. So while sir is connecting, I would request the audience to connect us through our online portal, which is Homeopathy 360. You can see the articles, the blogs, the news, all the information related to homeopathy, and also submit your articles and become part of Homeopathy 360 as well. Whether you are a beginner or you are a practitioner, you are all welcomed at Homeopathy 360. So audience, you can see in the chat box, we have put the Instagram as well as Homeopathy 360 YouTube channel link. So for all the webinars, the past as well as the current going one, as well as the future webinars, you can all watch here in these links. Please follow up at Homeopathy 360. You can subscribe to our YouTube channel where we continuously upload expert talks and webinars and their success stories. And this is how we continue learning.
Hello.
Yeah, that's okay, sir. Sir, you are inaudible. Please check your audio.
Now properly?
Yes, yes. All right.
I hope now my screen is visible.
Yes, sir.
Starting with the discussion that what was the purpose for selecting this topic, and to prove the topic itself, nature had put myself into the stress that I was going to give you a smooth start, but my PC stopped working, and at the point of initiation itself, we have to go for a break. So this is sometimes the stress which we are dealing with in our day-to-day life. And the point for what I have selected this topic is, as we can see, it is something personal and universal that we all, as human beings, not as doctors or students or social workers, we have gone through COVID-19. Then we are right now going through various changes in environment. Various changes are happening all around us, whether it is in society or in our relationships. And all these directly or indirectly puts us into stress. whether that stress is good, bad, hurting us, or we are neglecting it, but it is always around us and it starts eating us from within. So, how to handle that stress, whether it is physical, mental, emotional? We have chosen this topic to discuss it and to try to avoid it. Let's move furthermore that there is an interconnected web which sometimes we know and sometimes we do not, that is between stress, sleep, and immunity. And within this presentation, I have tried to show that how this web is interconnected with each other, and not only for layman, but it has some scientific backgrounds also that I have tried to put in front of all of you. So, what is health? Many of us are dealing with homeopathy right now. So, we know that Master Hahnemann, he has given us a very gentle and scientific yet philosophical definition for health. That means it's not just the absence of disease, but a state of complete physical, mental, and social well being. Like, let us put myself in this definition that if I am wearing specs, okay, I am not healthy. But because I'm not feeling any disturbances with my spectacles on, I'm feeling myself healthy. So, according to this definition, many of us are not healthy anymore. So, what we feel that if I am going nice today, that means I am not having any disease. Whenever I will face any difficulty, I will look into that. But that's not the right point of view to wait for disease to enter in our body and start disrupting our day-to-day life. So health, as we have seen, that many a times we are not healthy, but because we are not having exact diagnosis with disease, we are calling ourselves healthy. So, as we were discussing about stress, so we cannot avoid stress on day-to-day life. But what happens that it starts to disrupt our inner balance, it disturbs our sleep, and with that, silently it starts weakening our immunity, which sets a chain reaction which we need to break. We can call stress as a modern epidemic. The picture is very meaningful that every night when we are going to sleep, we have thousands of things on our mind. And when we wake up, we are adding some more on that to-do list. So our current modern epidemic from which all of us are suffering, that is stress. Scientifically, stress is the body's natural physiological response to any demand or challenge, which may be real or just because we are anxious, we are keeping it in our mind, which is actually an evolutionary mechanism given by God that we are overlooking something coming to us and we start dealing with it in our mind itself. So it may be for survival also, or it may be for fight or flight reaction also. So what stress is actually, it can happen when we have so much to do. We are worried about something which may or may not going to happen, or sometimes something unexpected happens, like we forgot something to bring, we face through traffic, or we have to go reach somewhere at time and we have been late. All these things are putting stress, and we are thinking that this is not going to affect my body or my health, but directly or indirectly it is going to affect our health. And you can see it in our day-to-day life and our clinics also, that most of the men and women, particularly running through their mid-age, they all are tend or going towards suffering from either diabetes or hypertension. And why it is happening, we will try to learn it by this presentation. How our body will react to stress, then here it may be our heart starts beating faster, we start feeling nervous. At the evening, all of us are feeling like these only, that though we haven't done anything physical, at the evening, we all feel drenched, tired, and we all rush towards home. And in home also, we always rush towards bed. That we are so tired, we are so drenched, and we do not want to do anything except getting rest or sleep. Okay. So stress can be classified into various heads. Here we are talking about its classification according to its purpose. So it can be classified into two. Amongst first is eustress, or you can call it a good stress. Yes, believe me, stress can be good also. So it is a positive stress which helps us to stay motivated, focused, and productive. And we all know very well, without any challenge, we if are completely satisfied, we feel like there is nothing to do with the life or day, or there is nothing to do with our job. So it's always good to have challenges. Examples of eustress can be studying a test if you want to do well on that, applying for a new job, or when you have got a job, you are having stress, but you are still in a positive way, going for a sports match, whichever sports we are into, planning for a trip. We know we are going to enjoy, but we still feel stressed that what will happen. So your stress is always pushing us to do our best. So it is helping, it's not hurting. This picture depicts that what happens if we remain in that good stress. So this eustress is good for our development in any particular field. If you are studying, eustress is good. If you are into practice, eustress is good, that you are trying your best to give your patient a very good health, or you can say you are trying to give him cure. Another thing that we know very well, without any pressure, there is no stimulation or motivation to achieve anything. So we always need some kind of stress or eustress which keeps us kicking towards the best of us. But when this stress goes out of our control, like if one student who knows that after 6 months they are going to face their first terminal exams, but they keep on avoiding the reading or preparation for 5.5 months, and then the stress comes, which is not a use stress. Okay, then whichever stress arises is this stress. So the trick is find your stress in time. If you are not finding your eustress in time, then you are going to go through the bad stress, that is a distress. So it is a negative stress which makes us anxious or unhappy. And yes, it will make us feel draining, frustrating, or painful. Examples can be a bad time with friends or family. Always people feel that nobody is understanding me. Having too much homework, especially when you have neglected it, and no time to complete it. There are few circumstances around money or health, or being in a toxic environment or unsafe environment, whether at your job place or in your home or in society. So what this stress makes us feel, makes us feel bad, and if it lasts for a longer duration, it will start eating our health. Now, another mode of classification of stress is according to duration by which we are passing through the stress, that can be acute or chronic. So acute stress, as we can understand, it is a short-term response to an immediate challenge or threat, like feeling nervous before an exam, or just being started after a loud noise which has took place behind us. While chronic stress is a long-term stress which persists, and it starts taking toll on our health, like constant work pressure, caring for a sick family member, or going through financial problem. Now going through the clinical impacts of stress. So as we have discussed that it can be of many forms, and it starts exerting a profound influence on our physiological processes with various ramifications with or without our knowledge. If we consider our bodily reactions, that is physiological reactions towards acute and chronic stress, Then when we are going through acute stress, our body is getting triggered and it tries to adapt fight or flight response, that whether we are capable of going through this stress or we must avoid this stress. And this is achieved by increased catecholamine reactions, that is our adrenaline and noradrenaline. While if we are going through chronic stress, whether it is related with job, whether it is related with family, society, or economics, then it is going to remain for a longer duration. Then it is starting with sustained cortisol elevation, that our corticosteroid levels are remaining higher for a longer duration, and that is more dangerous as it results into immune suppression. What are the clinical outcomes because of these physiological responses? It starts affecting cardiometabolic health, which can lead us into hypertension and various metabolic syndromes. Neuropsychiatric manifestations like sleep disorders, anxiety, and depressive states, which are frequently exacerbated by stress, and immune dysregulation, that this chronic stress contributes to recurrent infection and can trigger many autoimmune flares also. That many are times. Now, before going to next slide, we as clinicians, we are seeing a number of patients coming with this type of disorders, mainly those patients who are in their midlife, whether males or females, they are start developing either hypertension or sleep related disorders, or they come up with hyperlipidemias, or they have borderline diabetes mellitus. Another set of patients, they are coming up with repeated infections, just like simple cold coryza, even with some skin related disorders, which they usually tell that this is happening very first time to me. I have never suffered from such type of symptoms. And this is the alarming sign that the individual has now started to pay the toll through his health, which has been given by stress. So what happens when individual is going through stress, whether it is physical, emotional, or mental? It stimulates our hypothalamus, and hypothalamus releases CRH, that is our corticotropin releasing hormone. That CRH stimulates pituitary to release ACTH, that is adrenocorticotropic hormone, and that influences adrenal gland either to release cortisol or catecholamines, that is adrenaline and noradrenaline. When cortisol level rises, it increases blood sugar level, it decreases immunity because it is an immunosuppressive hormone, and it makes us more prone towards more inflammatory reactions, and we are more prone to suffer from many infections. When adrenaline and noradrenaline levels are increased, it increases heart rate, it increases blood pressure, and it increases our alertness, which gives us body's response of fight or flight. But if it is happening for a shorter duration, then it is good. If it remains for a longer duration, then this hormonal disturbance will give us permanent gifts of sleep disturbance, low immunity, and various metabolic disorders. Here, I have tried to put an emphasis that what will happen if we keep on going through stress again and again. So there are three stages of stress which will initiate different set of impacts in our body. So first stage of stress is alarm, that first time we or our brain has find out something as a threat or a trigger, which activates our amygdala, which is a part of our brain, and that amygdala finally leads us to release adrenaline secretion, which helps many a times to condition a reaction towards the stress. Now, if you know how our brain works, like brain is a very powerful gift to us, specifically human beings, from nature, that it has given us many programs. Like if we are talking about AI now, then our brain is natural AI, that every time when you give our brain a new challenge, it not only tries to solve it, but it also tries to keep it stored for lifetime. That once we have learned that 2 plus 2 is 4, not only our brain tries to understand it, but it also sends it to memory. And it is used whenever it is required. So if the threat is for first time, then your brain will process it and find out the best response, whether you can fight it or you have to fight it or you just have to freeze from that threat. But once the answer has came, your brain can tackle it very nicely on repeated exposure. So temporarily, in alarming stress, it will increase the heart rate, it will increase the blood pressure, and it will also increase the muscular tension. For this particular duration of time, individual loses the focus and there is a chain of thoughts running in the brain, and the sense or feeling through which the individual is going in this time is fear and anxiety like sensations. Then if this type of stress persists for a longer duration, then comes the second stage, that is resistance. If the stressors persist for a longer time, then hypothalamus pituitary axis is getting activated. And then the second one comes, that is cortisol, which helps us physical and mental popping up towards that stressor or how to resist that stress. And why this type of changes are happening, because there is a word in physiology which comes as homeostasis, where homeostasis means that similar type of environment should be maintained in the body for best outcome of all the bodily functions. So because body is seeking homeostasis, and this stress is not letting the homeostasis to get maintained. So now body has chosen another way to react towards that stress. First way was releasing adrenaline. Now the second way is through cortisol. And now that raised cortisol level is going to give us poor sleep, low immunity, there is unstable mood, mental fatigue, and high emotional reactivity. That even small trigger enlightens or gives a rage like reaction. Many a times individual comes to us at clinic and they say that after I react, I come to know that I have overreacted. It was not that serious matter, but I have reacted too much. Now it is hurting me. But they themselves are not responsible for that because their brain is now getting tired. Now comes the third stage, which is more dangerous, that is exhaustion. The word itself suggests that system is now getting tired, system is now getting drained. So when stressors are getting overwhelmed, then multiple reactions starts and body tries to adapt the situation and circumstances as bodily reactions are not working anymore. Okay, so the word comes that body is in exhaustion and body's responses are depleted. So what it will give us? It will give us chronic fatigue and poor health, even mental health and cognitive declination. Cognitive declination, that means we are not capable of understanding simple things. We are getting very poor towards learning. We are getting numb, detached, and starting to have mood disorder. Numb, that means many a times we see that even severe emotional circumstances are there around, but person fails to react against it. And this is because of the stages of stress through which individual has gone through. So this is the cycle which starts with stress that leads to increased level of cortisol, adrenaline, and noradrenaline that makes our brain hyperactive. That hyperactive brain, which will give us either poor sleep or we will start suffering from insomnia. That will finally lead us to depletion of neurotransmitter balance. We all know that there are substances which are called as neurotransmitters. They are the chemical substances. Particularly, they are getting released at the synaptic junctions between neurons. So whether we are doing any good activity or bad activity within our mind, whether it is physical, emotional, or intellectual, the higher centers of our brain releases these neurotransmitters, and these neurotransmitters are not sufficient. When I am saying sufficient, that means they also get depleted if they keep on getting released for a longer duration. So that's what is happening in such circumstances, that neurotransmitter balance goes in negative, which finally leads to anxiety, irritability, and more stress. And then this stress cycle repeats. So now we have entered into a point where we have to decide that whether we should just accept this stress and its ill effects as a permanent part of our lives, because many stress cannot be avoided. We know we are going through corporate lifestyle. We are having so many expectations from ourselves also, and society is also demanding many things from us. So we cannot live without challenges. So what is in our health, in our hands? So it is in our hand that we should not allow it to harm our health, but we should tackle it wisely. What we can do, we should put our efforts, as here it is written, that many a times what happens, that we are putting our efforts in carrying our diet, that we are going for dietitians, we are going for trichologists for our health of hair, we are going to many cosmetologists for our external appearance, but we are neglecting a very crucial pillar which is essential for managing all these parts of our bodily health, that is the sleep, which can provide all required restorative processes, which we will see further on. What happens that after knowing this much also, and we are knowing that we have got 24 hours of fixed time in our day-to-day routine. So what we usually do, that whenever we have to cut short anything, we always try to cut short the sleep, and we tend to stay awake late at night, and we are using that time for entertainment or many social commitments or trying to complete the work which we have kept lingering, and then it has put a load on our head. So over the time, this overlooking habit of sleep diminishes our capacity to deal the stress. It weakens our system and reduces our ability to enjoy our life. So while stress may not be avoidable, the way to respond toward the stress is in our hand. And to respond the stress, we have got a simple, most effective, and natural remedy, which is in our hands itself. We do not need any medicines for that. We need not to go for anyone for guidance. We have it with us from our birth, that is a restful sleep. So as we value food, fitness, and our appearance, we must understand the value of a restful sleep. Now, as I have been emphasizing that we should sleep, we should sleep. So what is an ideal sleep? So ideal sleep is a state of naturally recurring, reversible loss of consciousness and responsiveness, characterized by reduced interaction with the environment, having distinct stages of non-rapid eye movement and rapid eye movement sleep, which is regulated by circadian and homeostatic processes, which is required for optimal brain, metabolic, and physiological functioning. So you can see this is a very complex description of sleep, but if we break it word by word, then we can understand it very formally. that it is a naturally recurring thing. It's not something unnatural. Many a times in our day-to-day life, we start feeling drowsy and we say that I am not feeling much alert. That is because of depletion of our bodily resources. So it is naturally recurring, reversible loss of consciousness and responsiveness that ideally when we are sleeping, we should not be aware about our surroundings. These REM and NREM, they are the scientific words that even during our sleep, our eyeballs are moving. Though eyes are closed, our eyeballs are moving. And this sleep is regulated by circadian and homeostatic processes. Circadian rhythm, we know very well that our brain, particularly hypothalamus, is controlling the circadian rhythm. And this sleep is required for optimal functioning of brain, metabolism, and various physiological processes. Here comes a very good line that says a good sleep is not just about the number of hours we spend in our bed. Many a times patient comes to us and say that, sir, I am passing 8 hours in my bed. So it's not about just passing that much amount of time in bed. It's also about quality consistency of sleep, which something like this. So how much time we should spend during sleep? I'm talking about sleep, not in bed. So it should be 7 to 9 hours for adults. Latency, that means how much time one should take to go into sleep, that is less than 30 minutes. Continuity should be, there should be no awakenings during night. Efficiency of sleep should be more than 85%. Consistency, that comes of the time that one should sleep same time and awake at the same time daily. Then feeling rested, that when we wake up, we should feel rested, not tired. There should be no signs of apnea or insomnia during sleep. Now, what is the importance of sleep? That why we are talking so much or giving so much emphasis towards the sleep? Because as we have said that it restores the health during sleep. We all know that when a lady gets pregnant and then they go for repeated USG examinations, at the third trimesters, the radiologist gives in writing that fetal heart beats are found. So we all know that heart is pumping during that time up to our death without any rest. So if we are not taking sleep, as they have written in this particular slide, our normal heart rate is 72 per minute, ranging between 70 to 80. That goes up to 45 to 60 during sleep. So you can see that if we sleep peacefully, our heart also gets some rest. Let us see what part of body gets what from sleep. So plasma volume decreases by about 10%. Blood pressure goes down, particularly systolic pressure goes down 90 to 100 millimeter of mercury, and it goes lowest at the fourth hour, and it tends to rise back at the time of waking. Our respiration, the rate and force also starts to decrease. Salivary secretion also decreases. Gastric secretion either gets unchanged or slightly increases. Stomach contractions are getting vigorous when it's empty. Urine formation decreases and specific gravity increases. That is the reason that if we are trying to get our urine checked, physician suggests early morning urine is required. Then sweat secretion increases, which is the excretory function of our body, that waste metabolites are getting thrown out of our body during our sleep. Lacrimal secretion is also decreases. Lacrimal secretion is not only for tears, but it is keeping our eyes moist. So throughout the day, if the number of duration in which our eyes are remaining open, that means our lacrimal glands are also getting tired and exhausted. So if we sleep for sufficient time, our lacrimal glands also getting some rest, and it can store more tears as and when required. Then muscle tone, that is also greatly reduced. except in ocular muscles. Our reflexes are also abolished, that our body is going completely into a relaxed position. Size of pupil and reflexes, pupil is getting constricted, light reflex is there, but eyeball movement is also down. Brain is not completely inactive. EEG shows cyclic changes. Electric activities are also there. But in peaceful sleep without any dreams, brain is also getting very much relaxed. So, in simple terms, we can say the sleep is a reset button for brain. So, during sleep, brain undergoes crucial restorative processes which has impact overall health and functionality of our body. That it clears toxin, it receives or it restores the neurotransmitter and hormonal balances. It also gives some time for its neuronal processes and it strengthens our memory. And if all of these has happened positively, then it restores our energy and what we feel in the morning, that we are fresh and energetic. So resting brain gives us cleaning, healing, balancing, and recharging. Now, another term that comes, that our modern medical science, allied science, also believes this, that there is a axis which is psychoneuroimmunology axis, and it has something to do with our brain and our sleep also. So quality sleep is indispensable for neuronal repair, hormonal balance, and robust immune competence, which allows the body to restore and regulate vital physiological processes. Now, why this sleep time and sleep duration is essential? Because there is a nucleus in our hypothalamus which is called as suprachiasmatic nucleus, which actually works as our master clock of our human body, and it orchestrates the whole circadian rhythm or biological clock, we call it. And its sensitivity is towards light exposure, and it arranges the whole of our day-to-day practices. That this suprachiasmatic nucleus is responsible or is responsive towards the darkness and light. So as darkness falls, I'm talking about night, not emotional darkness. It signals the pineal gland to release melatonin, which is a sleep hormone, and it facilitates the deep sleep and other bodily repair processes. Light at night, if we are exposed to light, especially artificial light and blue light from our mobile phones or televisions, it suppresses the melatonin production and it increases cortisol levels, which leads to delay in the sleep onset and it disturbs the sleep quality. Consequences may happen after chronic disruption of natural light dark cycle, which leads to insomnia, increased risk of obesity, heightened stress levels, and weakened immune function. This image exactly depicts what happens, that there are three stimulations are there for suprachiasmatic nucleus to release melatonin through pineal gland. So one is environment or day-to-day routine, another is genes, and third is exposure to light. If light comes through eyeballs and if darkness comes through eyeball, so if the eyeballs see that there is darkness, then it stimulates pineal gland to release melatonin, and that melatonin will lead us to go towards the sleep. What are the real world consequences? We know that there are three types of people around us. One are the overworked professionals. They have to go through high work stresses, which make them more vulnerable towards frequent colds, flu, and pervasive fatigue. Second one are the students who are under pressure. And third are night shift workers, that their circadian rhythm are changes on day-to-day basis. What happens during sleep towards our various systems that I have tried to put in, that if we sleep on time according to the ideal sleep definition, then it will produce cytokines, which are proteins that fights against infection and inflammation. And if we are not having enough sleep, then we are having few cytokines, higher risk of infection and slow recovery. Hormones, sleep regulates insulin, poor sleep, there is insulin resistance, increased risk of diabetes mellitus. If we are having poor sleep, then it increases the level of ghrelin, which gives or keeps us hungry all the times, which also decreases leptin secretion, which gives us satisfactory sensation of food. So it gives us more appetite, which leads us to weight gain that we call as obesity, which is mother of many diseases. Cortisol usually goes low at night, but if we are not sleeping on time, it will lead us or give us high levels of cortisol. For circulatory system, chronic sleep deprivation will increase blood pressure, increase chances of stroke, and increase heart disease. For gastrointestinal system, if we are not having sufficient sleep, then decreased gastric emptying, which will lead us to indigestion and bloating. There is increased acid secretion, which may lead us to gastritis or acid reflux disease. It also alters the gut microbiome and it will lead us to dysbiosis. There is appetite dysregulation or loss of appetite, which may lead to obesity or completely anorexia. And there is increased intestinal permeability, which may also come up as IBS-like symptoms. For CNS, sleep regulates the neurotransmitter as we have discussed earlier, like serotonin, dopamine, and gamma aminobutyric acid or GABA, which has got following functions. So if we talk about serotonin, it is involved in initiating sleep, which acts as a precursor of melatonin, which is a sleep hormone. Serotonin is responsible for stability of mood. It is also dealing with sleep, appetite, and gut function. If serotonin levels are low, then person may suffer from depression, anxiety, and insomnia. Simultaneously, if the levels are higher, then person may suffer from serotonin syndrome. For dopamine, it is responsible for our reward and motivation. It leads us to focus, learning. It also controls prolactin. Higher dopamine levels are giving us wakefulness and arousal, and too much dopamine also disrupts sleep. At this point, I would also like to add that if someone is using so much mobile, particularly the reels of Instagram or TikTok like things, then they are responsible for increase our dopamine levels to a greater extent, or it keeps the dopamine level higher side for a longer duration, which also going to disturb our sleep. Next is gamma aminobutyric acid or gamma, which is a negative or inhibitory neurotransmitter, which calms our brain down, that reduces anxiety, it promotes sleep, it even gives relaxation to muscles, it prevents seizure-like symptoms. So these all neurotransmitters are balanced during our sleep. Next, for respiratory system, because during sleep everything is getting settled down, everything is getting relaxed, body's oxygen demand also reduces. So rate and force of respiration relaxes or reduces, which allows the respiratory muscles to relax and recover. It also provides lung immunity to get enhanced during sleep. Now, sleep's influence on reproductive health, which is also a burning question right now in today's era. So, sleep profoundly regulates hypothalamic pituitary gonadal axis, which controls the reproductive hormones like GnRH, luteinizing hormone, and FSH. For women, chronic poor sleep leads to irregular menstrual cycle, ovulatory dysfunction, and increased difficulties with conception and maintaining a healthy pregnancy. Even a more number of females or young females are also suffering from PCOS-like symptoms because of these causes. For males, insufficient sleep is associated with decreased testosterone level, compromised sperm quality, and it affects overall reproductive potential of a male. So from this discussion, we can see that stress, sleep, and immunity, they are very deeply interconnected with each other. Even our whole bodily systems are getting affected by this delicate balance, and we need to adopt a healthy sleep cycle to break this vicious cycle before getting into any difficulty. So there is the hidden triangle, which is having a bidirectional relationship. The word hidden triangle, which we have put into our heading, that is having three sides of the triangle interconnected with each other. That higher level of stress directly impairs our sleep quality, which leads us to either insomnia or fragmented sleep pattern. Sleep disturbances is going to affect our immunity, which makes our body more vulnerable towards pathogen. And that weaker immunity or makes us suffer from various pathological conditions, which puts us back into stressful condition. So prolonged sleep deprivation significantly amplifies our stress responses, which contributes to systemic inflammation or increased risk of any of the inflammatory conditions. So this is the vicious cycle which we are discussing about. What are the chances or what are the ways by which we can manage the stress? I have tried to short down few things. That first thing required, that is management of time. We can go through or have some nice music. We can take therapy. We can go for some spa like things. We have to go for exercise. Exercise is a very must thing to fight from stress, because exercise makes us release endorphin like substances which reduces the stress. Then to have a day-to-day hobby which also gives us satisfaction. Then meditation, yoga, and spending some regular time with nature. These are the good ways to manage the stress. Another thing, this picture depicts that what is happening when we goes to our bed to sleep. So these are the things which are on our mind during the sleep or when we go to sleep. So here we have tried to give us few ways to get a good sleep also. That one must take a shower, one must have a good dark environment by which, or you can say cozy environment or relaxed environment. When you are going to sleep and you are not having a comfortable pillow, you are not going to have a good sleep. You can read some nice book, you can have some nice music, you can do meditation or go for a walk. I'm talking about walk. Jogging is not going to work because it will make you more alert. Then another mode, how to go to sleep to earlier, that is also very essential. That one must put the digital screens away at least for 1 to 2 hours before going to sleep to reduce the dopamine levels. One must change the clothes which are tight fitted or ill fitted. One must take the pajamas or relaxed fitting clothes. One must take dinner earlier. Then avoid caffeine, alcohol, and cigarettes, not only during sleeping time, but throughout the day, which is essential. Create a comfortable sleep environment and set a day-to-day bedtime, which must be followed every day. Apart from that, healthy eating is also essential. This picture is very much meaningful. You might be looking at a very colorful picture, but it is very meaningful. That one must take enough water, that should be 4 to 5 liters in a day. One must take milk, then all the cereals and lentils, as they have shown, not a single cereal is going to work or not a single type of lentil is going to work. Then all the colorful vegetables, green vegetables, and all the fruits which are having various juices. All these things are rich with various nutrients, various antioxidant, various essential amino acids, but one has to take them on repetitive manner and in changing fashion. Like if I am taking only green leafy vegetables and not fruits, that is also not working. So healthy eating is also a part of taking care of our health. Now, what homeopathy can offer in this particular scenario? I know we are having a short time, so I will go a bit faster in this particular part. So homeopathy can help in managing stress. It also can reduce the anxiety. It also helps us in managing the sleep rhythm, and it also helps in immunomodulation. So this is the part which all homeopaths are knowing, that how homeopathy works. It especially works on the basis of individualization. Even it clears the miasmatic background, and it acts on all three levels, that is mental, general, and even physical. Key materia medica insights, I have put a few things, that if we are having stress and anxiety like symptoms, argentum, gelsemium, and aconite, they are the commonly go-to medicines. For insomnia or loss of sleep or sensitive sleep, we have got Coffea cruda, Nux vomica, and Passiflora. For immune modulation, we have got Calcarea carb, Silicea tuberculinum, or all of the many of the polycrest remedies can help us to fight against many autoimmune disorders or immunological conditions. Here, there are few slides which are containing details of homeopathic medicines like Coffea cruda, Nux vomica, Ignatia, Aconite, arsenic, Passiflora, Califos, Lycopodium, Gelsemium, Chamomilla, Phosphorus, Pulsatilla, Calcarea carb, Kalias, and Argentum nitricum, which we can go through our materia medica books also, that in which conditions they can help. Coming back to what should be done with such patients. So not only medicines, many a times what we see that patients are expecting only medicines to get out of their such conditions. Then we have to make them aware that only medicines are not going to work, because integrating lifestyle advice along with clinical interventions reduces their problem, and it promotes sustained wellness for a longer duration. So we have to give them nutritional guidance, that it should be well tailored dietary recommendation to all patients individually, because we know in homeopathy each individual is unique. Then we have to guide them for mindfulness and meditation according to their requirement. Apart from that, we should also prescribe them some movement according to their age group. If the patient is of old age group, we have to guide them accordingly. If the patients are in younger age group, we have to guide them for regular, stronger exercise or vigorous exercises. uh, Building resilient you, that is for each of us, that each one of us can see in mirror and see within us that what is to be done, that we ourselves only know that what is our current stress level, where our sleep is disturbed, and what is happening with our health. If we can change on our own, then we have to take some baby steps, just like making some good habits, whether going to sleep on daily time, going for 10 minutes of mindfulness, or going for a regular walk. Then also, if it's not working, then we should go for a healthcare professional or someone who is knowing properly about these systems. Yes, as a homeopath, I will always advocate the homeopathy, that if stress continues to weigh us down and we are not getting restful sleep, we must go for a proper homeopath to restore our health. Thank you very much.
Thank you so much, sir. You have brilliantly connected the dots between science and holistic healing, helping us understand not just the physiology, but also the importance of restoring balance in everyday life. So, as we wrap up today's enriching session, I would like to extend a heartfelt thanks to Dr. Mrugank for his depth of knowledge and the clarity. I also want to thank all the audience for their active participation and commitment to continuous learning. Let this session be a reminder that true health is not just the absence of disease, but a state of balance, mental, physical, as well as emotional. Please stay connected with Homeopathy 360 for more such valuable learning opportunities. Until next time, stay healthy, stay balanced, and stay inspired. Thank you once again, sir.
Thank you very much. Thank you.
Thank you, everyone.